Schematherapy 03A Narcissistic Personality Disorder Childhood Experiences and Traumatic Experiences. Hello, I am Dr. Jason Lee, a clinical psychologist and clinical neuropsychologist. The development of narcissistic personality disorder (NPD) is closely related to experiences during childhood. These experiences may shape an individual's self-perception and behavior patterns. Here are some common childhood experiences and traumatic experiences that may contribute to the development of NPD. Childhood experiences. 1. Overindulgence, high demand, and overpraise are excessive praise and unrealistic self-image. If parents or caregivers often praise children excessively, for example by saying they are the smartest or the most special, it may lead to unrealistic self-perceptions. Children are taught that you are special, but are severely criticized when they make mistakes, which can lead them to develop an extreme self-evaluation of all good or all bad. Alternate praise and criticism. Parents sometimes praise their children strongly, e.g., "You are the best," but criticize them harshly when the child fails to meet expectations, which makes it difficult for the child to develop a stable sense of self-worth. See overindulgence and exaggerated narcissism. Parents who exaggerate their children's achievements but lack sincere emotional support may encourage children to develop sense of entitlement and exaggerated self-traits, which are related to NPD's exaggerated narcissism. 2. Emotional neglect, a lack of love and arrogance defense. If children do not receive enough love and recognition as they grow up, they may use arrogance to mask their inner emptiness. For example, parents focus only on their child's grades or achievements. 100 points is worth loving, ignoring their true emotional needs. B. Hot and cold care, lacking consistent care and response from parents. Children may learn to attract attention by exaggerating themselves or withdrawing. C. Emotional deprivation and fragile narcissism. Inadequate emotional support from parents leads to feelings of shame and inferiority within children, which is associated with NPD's fragile narcissism. In cases, patients scored higher on the emotional deprivation schema. 3. Overly powerful authority roles in the family. If parents are in control in an authoritarian manner, children may be forced to behave submissively or distort themselves in order to protect themselves, which can form a complex behavioral pattern of compliance and resistance coexisting. Second, traumatic experiences. Specific traumatic events may also trigger the development of NPD, and children may cope with pain by exaggerating themselves. For shame and bullying. Shame if children experience humiliation or demeaning as they grow up, such as being laughed at by classmates or being criticized for being useless by adults. They may use an arrogant appearance to mask their inner fragility. Be peer bullying or social exclusion in the early years. If children are rejected by their peers for a long time, they may develop implicit narcissism internally to maintain self-esteem, while becoming highly defensive and distrustful of others. 5. Abuse and abandonment. Whether physical or emotional abuse. It may allow children to learn to protect themselves with exaggerated self-images and avoid injury. B. Abandonment. If a child is abandoned by their parents or chronically lacks intimacy, they may lose trust in others and instead cope with life in a controlling or self-aggrandizing way. C. Combination of abuse and neglect. These experiences increase the risk of a child's unmet need for attachment. In the case, the patient scored 5 tenths on the Adverse Childhood Experience Questionnaire (ACEQ), indicating that she had experienced significant childhood trauma, such as emotional deprivation and abuse. 3. The view of schematherapy. Schematherapy believes that the development of NPD is the result of a combination of genetic factors and environmental influences, especially the influence of parenting style. Of overindulgence, parents who praise their children's achievements excessively but lack emotional support may lead to the formation of a sense of entitlement and an exaggerated self. B. Emotional neglect or abuse. This may lead to fragile self-esteem. Individuals defend against inner unease through narcissistic behavior. Patients in the case scored 5 tenths on the Adverse Childhood Experiences Questionnaire ACEQ. It was shown that she experienced significant childhood adversity, such as emotional deprivation and abuse, which likely contributed to her narcissistic traits and related behavioral patterns. Studies have shown that childhood adversity experiences, ACEs, are important risk factors for the development of NPD, including physical abuse, emotional abuse, sexual abuse, and emotional and physical neglect. Hope today's sharing will inspire you. See you next time.